Well, so last week we talked about laughter and nursing, and that was fun, and how that kind of relates to the right side of our brain. And so then we thought, well, this week let's talk about the left side of the brain and something that nurses do always and forever, even outside of the hospital. I find myself doing it, which is critical thinking.
Yeah.
Yeah, using the left side of the brain.
Yeah.
Hi, I'm Julie.
And I'm Caleb. Welcome to Nursing You, the podcast where we redefine nursing in today's healthcare landscape. Join Julie and I as we step outside the box on an unconventional healing journey.
Together, we're diving deep into the heart of nursing, exploring the intricate relationships between caregivers and patients with sincerity and depth.
Our mission is to create an open and collaborative experience where learning is expansive and fun.
From the psychological impacts of nursing to the larger implications on the healthcare system, we're sparking conversations that lead to healing and innovation.
We have serious experience and we won't pull our punches, but we'll also weave in some humor along the way because we all know laughter is often the best medicine.
It is, and we won't shy away from any topic, taboo or not. From violence and drugs to family and love, we're tackling it all.
Our nursing knowledge is our base, but we will be bringing insights from philosophy, religion, science, and art to deepen our understanding of the human experience.
So whether you're a nurse, a healthcare professional, or just someone curious about the world of caregiving, this podcast is for you.
One last thing, a quick disclaimer before we dive in. While we're both registered nurses, nothing we discuss here should be taken as medical advice. Always consult with your doctor or a qualified healthcare provider for any medical concerns you may have. The views expressed here are our own and don't necessarily reflect those of our employers or licensing bodies.
So let's get started on this journey together. Welcome to Nursing You, where every conversation leads to a healthier world.
Some people are born critical thinkers. Some people have to be taught. And I think you can learn how to critically think. You know, it takes practice. And I think critical thinking improves over time. Or does it just become easier? I'm not sure.
I feel like it is partly how information is organized in your mind,
Mm-hmm.
how readily available the information is, because you're applying your knowledge to a situation. I think that having the information stored in your mind in a organized way that allows you to kind of make connections and see what's happening objectively in whatever situation it is. Really having that information organized is critical or crucial to critical thinking.
Yeah. And they start to teach it in nursing school. Some people come in with it, but you learn to what information you have to organize, by them teaching the care plans. So that literally is almost a way of teaching critical thinking. So you have the problem, you have interventions because you have a goal, and then you look at the outcomes and then you reevaluate. And that literally is what critical thinking is. And so I think nurses, and I kind of just put that together, that we complain about those care plans and, all that, but what that is the critical thinking, is putting it all together. Patients come in with a problem. You have to figure out how to deal with it and what tasks you're going to do, the interventions to do it, because you have a goal for them, which is whatever it is, less pain, fix the belly, whatever. Right. And then you have outcomes, so you have to reevaluate. Did it work? Right. And then you have to go back and you have to think, if that didn't work, what you're going to do next. Yeah.
It's good.
So I think practicing that, and we practice it over and over and over and over again. And, sometimes it takes people longer than others to grasp it, but that is kind of the basis of nursing practice, really. So this says critical thinking is the process of analyzing, interpreting, evaluating, and synthesizing information gathered from observation, experience, reflection, reasoning, or communication. So that's basically what that is. And using the left side of the brain to do that is necessary when you are especially dealing with, critically ill patients.
Yeah.
Like, that's our experience is
Right.
critically ill or
Yeah.
emergency. But even like when I would float to med surge, that's a whole different way of critically thinking. In ICU, you've got your 2 patients and your little routine. And as you become more seasoned, it feels easier. It feels
Sure.
more manageable. But then, and those patients are sick. But then when I would float to the floor, I mean, my critically thinking brain and taking care of very critically ill ICU patients, it just went out the door. Like I had to really practice over and over trying to be able to manage the 6 patients and all of their things. And it was almost like if you take silly putty and then just like spread it out. That's how it felt. That's how my brain just went like that. And then and then I feel like I was pressing it down. When you press it down on a newspaper and you come back up and it has the image on it. That's how I felt on surge. Yeah. Couldn't handle it.
That's hilarious.
So that's a whole different, I mean, those nurses critically think in a whole different way.
Oh, absolutely. Absolutely.
Yeah. It's
Because the objective is slightly different. I mean,
Right.
in the critical care setting, we're like, we're trying to hold this soul in this body. And on the floor, that isn't necessarily the case. It's more like, how do I meet these objectives in a timely fashion so that everything that I have on this list to do gets done?
Yeah.
It's and still care for the person.
Yeah.
Yeah.
Because we know we were talking earlier about marrying the 2 sides of the brain. So you can't just solely function on using only one side of the brain. So you can't just go to work and use your right side of the brain and laugh and heal people. You can't just go in and creative and draw and like things are just going to work themselves out. It just doesn't work that way. But you also can't just use the left side of the brain and just be a tasker and not see the bigger picture and working towards, an outcome. It's almost like the patients, med-surg nurses are working with like 6 different patients. We're working with like 6 different systems within one patient.
Yeah. No, that's a good point.
Yeah.
And a lot of times there's less of the interpersonal element in the ICU because they're not walking and talking generally.
Right. Yeah. So it seems like it's more analytical and more left-sided brain task things, but really you have to be able to see the whole patient as well, just like, what do they say, synergistically or something. Because all the systems have to work together. So you constantly have to be just combining your knowledge about each system into the whole patient. Because if you give this drug to fix this, so say you give dopamine to fix a low blood pressure, but then the heart rate skyrockets. So now vascular dry. Now you need fluids. Well, so you give fluids. So now they're overloaded. So now they need to be intubated. You know what I mean? Like it's like every system affects the other, or then their kidneys shut down and now, or you give a medication and it affects the kidneys or, all of it, like everything affects everything else. So you really do have to be holistically looking and that type of thinking is using both sides of the brain.
Absolutely.
About being subjective and objective when we're, looking at the patient and how you can be looking at something subjectively, but you can't only do that. You have to use both. You have to look at the patient to know where you're going to go.
I mean, it is kind of, I mean, I think that is the dance of the right and left brain. I think there is like definitely a connection to subjective experience that informs right brain thinking. And then there's obviously the objective task oriented left side of the brain that is, the ability to reason and logic. And, I think I've said it before, we've talked about it before, the intuitive process of, especially in the ICU, when somebody can't communicate, there's like this expansion of your mind that you have to do to read the biological information that's coming to you from the body, that is, it's definitely connected to objective, you're observing, but there is just a synergistic dance between that subjective and objective right left hemisphere that we're constantly engaged in. I think that goes back to what we were talking about in last week, which is in that critical situation where it's going, wrong, something's happened, and everybody's just holding their breath, and there's just a pause in time, and the creativity that's used to unpause time and move things forward is humor. It just gets the two sides working again and moving in a positive direction. I don't know. I feel like
well, you can't, it's hard to just talk about critical thinking because you have to use both. And so, critical thinking in nursing is, there are a lot of different reasons why it's 100% necessary for patient safety, for just managing a critically ill patient, for, all the things that nurses do in one shift. It almost seems impossible, especially when you're saying it, just saying what critical thinking is. It just is like, how is that even possible? Like, how can someone do that? But
no, I think nursing is amazing.
Yeah, nursing is amazing.
It's amazing, and nurses are amazing. Like the skill that it takes to do this job is remarkable. On top of just the, like we've talked about before, the compassion and empathy that is, nobody just goes into nursing if they don't have that care piece within them. That's why, like, even, quote unquote, bad nurses are good people, because they wouldn't go into this work if they didn't have some part of them that cared about the people next to them.
Right.
I think that's one of the core pieces, and the altruistic piece, that, like, I want to help other people. And so you mix that with all the skill that requires all the knowledge that, is built up over years, and it just makes for a really incredible gift.
Yeah. My brain is just swarming with thinking of nurses that I've worked with over my years, and the different areas that we work in. Some of those med surg nurses were so much better than me in managing just patient relationships, relationships with other nurses, relationships with physicians, with administration, and then some of the ER nurses, like, that is no joke. Like, I'm not a true heart ER nurse. I've done some ER. I did a kind of a critical care float for a while, and I would go down to the ER, and I would just never leave. And you're there I might have been there for 5 hours of my shift, and you don't pee, you don't sit down, you don't take a bite of anything. You're literally putting out fires, always using your mind, like, what is next, managing. That is incredible work. And, but then you have, like, nurses on the oncology unit who, they might not have as many things going on, but the amount of information that they know about their patients, the chemo, the side effects, and their whole whole person, the patient that they're taking care of, the family dynamics, it truly is incredible to be a nurse. And, critical thinking is just a part of it, but you almost can't really you can't take it out. It's
Right.
100% necessary.
Well, I think it's innate. I think it's just it is the nursing process. Critical thinking is the nursing process.
It really is. Yeah.
Constantly assessing and evaluating. I mean, I think about that. Like, I talked to somebody a long time ago about this person had a brother or somebody that this guy was always finding himself in situations where people needed him in a healthcare setting. And it's almost like because we're trained to observe and look for problems, it's almost like the people that need us, like, present their problems around us. Cause I mean, I've had, a handful of public instances where I had to provide care in public, and it's like, why me? And it's like, like, is that my brain? Is it just my brain that's projecting that on? Like, cause I'm always looking, I'm never not looking. I'm looking at your skin. I'm looking at how you're breathing. I'm looking,
Yeah.
like looking at your veins, all the things, never not looking.
And, so how do you think,
creating that? That's the question.
Yeah. Well, I think it's definitely an energy, that is projected, because I've heard of that a lot from nurses. They're like, I don't know. People just come to me and they just feel like they can say whatever. I'm like, I don't even know you, know? But, and so how do you think critical
That literally
thinking,
just happened to me this morning in a conversation.
Oh my God.
I just ended up taking care of somebody. I just realized that, like, it just happens.
Yeah. It just happens.
It just happens. You don't even think about it.
No, I think that, I believe a lot in energy, and through my healing and learning how to heal myself, learning about energy has helped me understand a lot about myself and about me being in the world, and what I'm seeing is a reflection of what is in me. And so if I can change what is in me, then my surroundings literally change. And I have so many examples of that, but the energy of being a nurse and having that kind of capacity in your brain exudes an energy. And it's just how it is. And I think I would love to talk to other nurses. I think, they would be like 100%. Like, that's just how it is. Yeah. So how else does critically thinking as a nurse affect you on the outside of being in a hospital with patients?
I'm a little bit stuck on your statement about energy.
Oh.
And I'm curious because when you say energy, it seems so, that is such a, like, what does it mean? What is the objective reality of energy? Like, it's so hard to define.
It is, but for me, if I had to like really define, it would be like a frequency, or, like our brain has waves of energy and it can be traced, and our heart has waves, frequencies of energy that can be measured, and our nervous system fires, and it's all energetic because everything is electrons and protons. So everything is energetic in terms of waves, and depending on the speed of the wave, it can become a solid so that then you can see it. So being able to change my frequency by changing my vibration, which emotions and thoughts all have energy behind them, or frequencies and vibration, and the vibration then creates the wave. And so raising your vibration by raising and changing your thoughts and your emotions and how you feelings raising that to a different frequency literally allows you to attract something different. So if you're low frequency and you're low vibrations with anxiety, depression, shame, anger, bitterness, hatred, those are all like very low. Those emotions in science have been tested and they are very low vibration frequencies.
Mhm.
So you will attract more like that because like attracts like.
Mhm.
So if you can raise your vibration and one way to do it is by changing the way that you feel about things, then you raise your frequency, therefore attracting other higher frequencies. Does that make any sense?
Yeah, I mean, it's taking me to consciousness. Like the
Yeah.
consciousness is really the challenge. Like, we and going taking it back, I think I might have mentioned this last week. I hate to repeat myself, but
Mhm.
the idea of the two hemispheres of the brain being separated, and that it's kind of our task to unify them, is really kind of the challenge. If you're not aware that your right brain is going this way and your left brain is going this way, and that you have to, like, in order for you to be able to achieve any objective from the left side, you have to have creative vision first.
Mhm.
That the creative vision is what allows the left side to plot out the course to achieve.
Mhm.
And so that is the propelling force or propelling power of the unification of creativity and reason. And so that's kind of the I think of it as the vehicle to carry forward your consciousness. So you could have the consciousness piece, like how much negativity we take on as nurses. I mean,
Mhm.
this is getting to it. Like when, the violence that this career has exposed us to. And a lot of times the patients don't even know that they're doing it. They're not even
Right.
aware of the violence that they're projecting onto us. And so those experiences really take us down in our in our frequency. I
Mhm.
feel
Mhm.
like I feel like when we talk about frequency, it feels so ubiquitous, just
Mhm.
like so undefined.
It is,
And
it is, and I think it's just one way to explain probably, eh, something or and you would probably explain it in a different way.
well, I mean,
Um,
I'm 100% behind. So I'm not criticizing at all. I it, it and I actually think that the future of healthcare is in waveform. It's waveform technology.
yeah,
I
yeah,
don't think
yeah.
there's any way around the future. Like, you know, there's vortex mathematics that seems to permeate nature at every level. Like everywhere once you kind of have eyes that are able to see the waveform, the underlying waveform structure of reality, then you just observe it everywhere. I see it everywhere.
Yeah, exactly.
And I mean, that's, that my art is definitely informed by that. And part of the idea, once I was able to see it, part of the idea was, my entire adult life, my entire career has been spent observing biological waveforms.
Yeah.
EEGs, EKGs, all, the full
Yes,
spectrum of biological waveforms that we
yes,
monitor, like on an open heart. That's
yeah,
probably
yeah.
the most visual
Right, right.
biological waveforms you can monitor. Yeah.
You get the 2 EKG tracings, you get an oxygen saturation, pleth or tracing, that's what that is, the
Mhm.
waveform. You get
Mhm.
CVP waveform, you get, the cardiac output and index waveforms, you get, SV waveform, and then, I mean, they're just everything can be visualized in
Mhm.
waveform as a
Mhm.
waveform. but you don't see it
and
until you
sound waves.
and
Uh,
sound waves, yeah.
Yeah, sound waves, and then we can give signals like a train of four. We're giving a waveform, electrical
Mhm,
waveform that
mhm.
is, you know, are we effectively paralyzing this person?
Right, yeah.
Yeah, yeah, that's so cool. It's so
It
amazing.
is very cool,
It's
yeah,
so incredible.
yeah,
Like, it's awesome. Yeah.
yeah. So, I never because I really just kinda started thinking about this, and I was already not away from the bedside because I went away from the bedside for about, like, a year, and then I went back just to PRN. But during that time, prior to when I stepped away, I wasn't thinking this way. So
Mhm,
I don't have experience of being in an ICU knowing and feeling what I feel now. So I always try to notice I just notice things different now when because I sometimes I'll work ER, but I usually work like PACU and recovery room and that. And you can just see it differently. You just see it differently. I don't
mhm,
know if it's easier to interpret almost, when you're able to step back and not just see the physical form that you're looking at, but yet feel kind of what's going on, and then there's everything that the patient is exuding, emotions and,
mhm,
all of their the stress that they're under, that's all it's all waveforms and it
mhm.
has an effect on everything.
Right. I mean, I think because we're talking about clinical decision making, and then this is coming out as
Mhm,
the conversation. We
mhm,
don't script any of this. This is just a conversation between
yeah,
and this is coming out in the context of clinical decision making, which is objective and it is data driven,
mhm,
and that we're talking about something that's so ethereal
yeah,
and
ethereal,
like
mhm,
almost as if like so okay, I'll share this. It was a really like shocking discovery for me because I was thinking about Einstein's theory of relativity and let's see if I can articulate this properly. In order for Einstein to reach the level of where it's all relative. So this I think I've mentioned this before. Like one of the statements that I heard in the hospital a lot from my coworkers was it's all relative. All relative.
mhm,
And I was like, what does that mean? Because I adopted that philosophy too. And it intellectually allowed me to make decisions about my life that, it's all relative. When in reality, things do mean something.
yeah,
Either you believe that it's all relative and you become what I term a passive nihilist because that is a nihilistic statement. It's all relative. It doesn't mean because ultimately the interpretation of it's all relative is that it doesn't mean anything.
right,
And the conclusion that I have come to is that it does mean something. What
yeah,
we do absolutely is meaningful. And that we have to, especially as healthcare providers, when in the context of suffering and death, where you are watching these people lay there and die over and over and over, and that becomes your lived experience, it's easy because you got in one bed, you got a guy that has exercised every day of his life.
mhm,
He eats a very balanced meal every day, like does everything right, and that guy's dead.
mhm,
He dropped dead of whatever,
mhm,
and in the bed next to him, you got a guy that's gonna be discharged this afternoon and shouldn't have another chance, but because he's, addicted to crack cocaine, and
right.
he's like, you know, his heart's
Yeah,
the size of a freaking
sure,
football, and
right,
he's gonna go out, he's gonna do it again, and you're gonna see him next week, and you're like,
right,
does that mean? What does that
yeah,
mean? Like, what is it? Like,
right,
it doesn't mean anything. This guy did
mhm,
everything right, and there's like, it's it's outrageous,
yeah,
and so it's easy when you have that lived experience over and over and over so many
mhm,
times, um, that it's just like It's all relative, yeah. And that kind of becomes the echo chamber statement in the halls of the hospital. It's all relative. And I think that really is why so much of the healthcare population makes maladaptive choices. They
Yeah.
smoke. How many nurses do you know that smoke? How
Yeah.
many are alcoholics? How many are
Yeah.
doing the things?
Yeah.
So so that is kind of what informs my question, which was, what does it's all relative really mean? What does
Mhm.
that mean? And it led me to Einstein's theory of relativity. And as I contemplated everything that I read, the speed of light is the constant in his theory. And, to get to that point, he followed this is the realization. He followed objectivity all the way down to the depths where what was revealed is that it's relative. It's
Yeah.
relative to this constant. And so
Mhm.
in some sense, there is at least to me, and I could be entirely wrong. Somebody could watch this and be like, oh, he's out of his mind. He doesn't know what he's talking about. And it's true. I'm not a physicist. I'm not a
Yeah.
mathematician. I'm not any of those things. I'm a nurse. I'm just thinking,
Yeah.
I'm trying to make sense of this experience that I've
Yes.
had.
Yeah.
But to me, it seems that there is some connection that at the bottom of this objectivity, the two are kind of married together: objectivity and subjectivity, relativity and objectivity. And that was that's a really interesting thought, because so much of what we do is so objective, so data driven, and then the
Mhm.
outcomes are
Yeah.
out of your control.
Yeah. Well, and I think it
We live
leaves.
in that space between, as
Yeah.
nurses, as critical
Yeah.
care nurses, where people are dying.
Yeah.
We live in that
And
space between.
yeah. Yeah. And I think that it leaves nurses feeling that there is no meaning. And I know that I was there, like,
Mhm.
big time. What
Yeah.
what is the point of all of it? What is the point?
Uh-huh.
What is, and my demise was COVID, and
Uh-huh.
that was, a, huge flag during that whole time, which is, what is life? What is all this? What does this all mean? I'm just doing all of these tasks and, making so many decisions, and yet everyone is still dying. And, it really made me open my eyes to question, well, to realize where my mind had come, which
Mhm.
was a groundhog day. There is no meaning. I'm
Uh-huh.
just doing tasks, and, left me broken.
Uh-huh.
And, I didn't, I had to ask, what does this all mean?
Mhm.
Because, or does it even have meaning? And I found out, that obviously, yes, it does. But, I think a lot of nurses will be, I have seen also in the same boat of, this doesn't mean anything anyways. So they just come to
Uh-huh.
work. They're like robots, and I think they lose the ability to marry the two sides of their brain.
Mhm.
I think when life does not have meaning for you, you're not connected to the right side of your brain,
Mhm.
because, or you've lost the connection.
Well, I think that I've thought about this as well. Like the two, like you can use the creative side to go in an opposite direction of forward. You can,
Mhm.
like, the when you get to that point where it doesn't mean anything, then you're using the creativity. How do I get that next fix?
Mhm.
How do I get, whatever it is that I want, whatever it is
Mhm.
that, because these experiences that I'm having are hurting me so badly, and I want to escape them. How do I get that next escape? And so
Yeah.
that you are actually using your creativity in a negative direction when you do that.
Yeah.
So
Mhm.
the way out of it, like, this is where it comes back to consciousness, like
Yeah.
the, what you cultivate in your mind, and how you, like, if you don't have a vision forward, you can't go anywhere. And if
Right.
you're, the only thing you're doing is trying to mask the pain that you're having, you're using your creativity wrong,
Right.
and you have to find a path. And that's the value of rock bottom. Like at rock
Yeah.
bottom, I know something's got to change, and that something is me. Nobody else can change
Right.
but me. And then when you get to that place, then you start cultivating different habits. You start thinking in different patterns and in different ways. And you have to, like, that's been one of the imperatives to me, is that I can't do the same things that I've been doing. I have to
Yeah.
change. I
Right.
have to change.
Yeah.
Yeah.
Well, I mean, that's the whole thing, you don't, if nothing changes, you don't change. You
Yeah.
can't change. It doesn't happen. It can't. So
Yeah.
something has to change. And, for the longest time, I felt like it was trying to change things on the outside of my life, trying to change where I work, change the job, change the location, change the, and I thought, well, leave the bedside, do whatever. But it wasn't. It's actually going within and changing your own thought patterns about
Mhm.
what is going on, not
Right.
what is going on.
Mhm.
It and honestly, that uses critical thinking too. I mean, that is kind of the definition of it. You're almost like, well, you're nursing you're nursing yourself. You're using that thinking to get to a different place, where just like we're using our thinking to get those patients to a different place. And, having those skills. I mean, that's why I believe that every nurse can change, better their life, live better, feel better, and they don't necessarily have to leave the bedside. At
Uh-huh.
first oh my God, nobody, this, and I didn't want to be that nurse that was like, oh God, you got to get out of the hospital. It sucks. That's not really it. It's not really about what it is for me anymore. It's changing your own insides and the way that you feel. And there's a million ways to do that. But
Mhm.
once you kind of can figure out what it is that you need and be able to give that to yourself rather than seek it from outside of yourself, that's when healing can begin. That's when things start to look different on the outside to you, being present, being in the moment, looking up at the sky, realizing how small we actually are or how big
Mhm.
we actually are, how
Yeah.
powerful we really are, but that it's not all relative, that everything has meaning, everything that you view and see, and learning to appreciate the meaning of it, learning, I literally am now one of those weirdos who I love skies. I love sunsets. I love
Mm.
a sky and clouds and a bright sunny day with the puffy clouds. And,
Mhm.
I never, yeah. I mean, when it was like, the purples and the beautiful sky, you'd be like, oh my God, it's so beautiful. But up until just a couple years ago, that really, I kind of
Mhm.
knew the full moon work's going to suck tonight. That's about the extent of my, you know,
Well, I mean, that goes back to the frequency thing. I
yeah,
mean, the moon, like, we're 90% water. Like,
yeah,
we're all water,
yeah,
and that moon is pulling us up. It's
yeah,
pulling us up
yeah,
like everything else.
yeah,
And that is a frequency. There is a palpable energy at the hospital that
mhm,
every nurse that I know will agree that you can feel the moon. You
yeah,
can feel it. I don't necessarily. I can't. I I feel like 1 week before or 1 week after
yeah,
a full moon, like that kind of
yeah,
that that space surrounding the moon. I generally always have just some innate sense that
yeah,
we're at a full moon. We're
yeah,
right there,
right. Yeah,
which is a
things are
frequency thing. That's
yeah,
not a definable thing right now.
right, I know.
Yeah.
Yeah,
But the thing, like, I wanna share one thing, your appreciation for the world around you. Like,
mhm,
I had a meditation, somebody guided a meditation for me that it was actually instructions for a personal meditation to go sit in nature and look around at the regenerative nature of our reality, that everything is regenerating itself. Like, and I would encourage anyone that's listening to this to just go for a little walk, sit down in a park, and just look around. And I can't unsee how much life there is that's all around us. And I just have such a deep appreciation for how much life is around us, especially with the backdrop of nursing, where we've experienced so much. And to get to a place where I can go and sit in a park and look just at a blade of grass, it's like, how? It's so incredible. It's so beautiful. The world that we live in is so amazing. And I don't know that I could have that appreciation without having gone through everything that I've gone through.
Totally. No,
I
because
mean,
it's not, I think we're born with that, but then it's just programmed out of us. And,
yeah.
but it's always there. So it's almost like it takes something to like spark you to find it again. And it's not hard, but it definitely takes intention, because that's not what it's a habit. So we're not in the habit of looking and noticing like the leaves, waving to me there at the window, and, all the acorns on the ground, or we have walnut trees in our yard. And I was out there this morning, actually barefoot, walking in the grass, and I like to touch the trees, and I just touch you, and I'm thankful that you're here, and look how strong your roots are, and I'm going to get some of that. And I was noticing just on the ground, all the walnuts, the squirrels have like obliterated the walnuts, which is perfect, because the walnuts, we have so many that it's crazy, but then they eat up the mower. But I thought, that is they're eating all the walnuts, and they're just little pieces. And I thought, they are having so much fun out here. And like, that's like tree hugger type shit.
I want to expand out. Like, I'm listening to you talk, and in my mind, I'm thinking back to what we're talking about: clinical decision making, right? Yeah. The left side of the brain.
Yeah.
And so expand this view out, that we've spent all this time in critical care nursing where we're objective and we're task oriented and we're just marching through time in this orderly fashion. And it makes perfect sense when you zoom out and you look at what we're talking about, that this would be the conversation, because what we're talking about is the right side experience. Like we have this experience over here that informs this experience over here, and the two, like, we're unifying these two things right here in this conversation. It's incredible.
Yeah, it really has gone in an incredible direction today.
Yeah.
It really does. Sometimes we don't know, because really we don't script. We have ideas. Yeah, we have ideas, and we're going to talk about them. But our conversation is so just natural and inquisitive, and is meaningful, and it leads us to the direction that we're supposed to be led in. And I think we're both open-minded to that. And so I just, frequency flows right through. And to whoever needs to hear this will hear it. And that's, I think that's what we both go into this with.
So I want to circle back to the hospital and meaning, or lack of meaning in the hospital, because, that's what we're trying to help people contextualize their experience.
Yeah.
And I think that what I want to say about the experience of watching people suffer is that it's not meaningless what your experience. I mean, we don't know what that person is here for. We don't know what I guess it kind of gets into a spiritual conversation, that the body that you're caring for, like, it contained, you have to believe that it has a soul and that there's a higher power. And I mean, a lot of people don't. A lot of people think that. I mean, I don't know, and I don't really understand how. I mean, I don't understand how or why someone would choose to give care if they didn't believe in an afterlife or
Mhm.
a higher power. That doesn't make a whole lot of sense to me, because
Yeah.
that I mean, I'm okay with an atheist that says, you know, like, or maybe it's an agnostic, an atheist that
Mhm.
doesn't doesn't have the ability to articulate what God could be, like the
Right.
idea of God. Like, that's
Mhm.
okay. Like, if
Mhm.
like, because I wrestle with that. Like, we're told that God is, this guy in the sky,
Mhm.
and that doesn't jive for me at this point in my life.
Right. Mhm.
The idea that there is a creative force that is animating everything, yeah, I like, especially in the conversation of waveforms,
Mhm.
that there's this emanating force that's giving life to everything. That's
Mhm.
God, like,
Yeah.
whatever that is. I mean, that
Right. Right.
I remember years ago, kind of at the beginning of my spiral down, laying in the bed of my truck, looking up at the stars, going, forget everything that I've been told about what God is.
Mhm.
Whatever did all that up there, that's who I'm talking to.
Yeah. Yeah.
And and that, we have so many preconceived ideas, and we're never really given the opportunity to think for ourselves about what God is, or
Well, right.
what
We're told. Yeah, we're
we're
told.
told.
Yeah.
We're programmed to believe what we believe, and when you get to that bottom point where it doesn't mean anything anymore, where none of this experience means anything, I think that, it's like the starfish. It's like the kid out there throwing the starfish back in the sea, and the guy says, "You're wasting your time. You can't save them all." And he says, "I know I can't save them all, but for this one, I can." And keeping in perspective that there is a person with a soul in your care, and it is meaningful, even though it does feel like you're on repeat. It feels like
Mhm.
Groundhog Day. There is meaning in every task that you're performing for that person,
Yeah.
and whether you're able to realize it or not, there is a deep meaning to the work that
Yeah.
you're doing.
Yeah. And it may not feel like it. And I know, like, if someone would have said that to me, I would have been like, but yeah, but like, I don't feel it. But like, what if you could? What if there
Mhm.
was? What if you thought? What if everything that happens is meaning in your life? What if those patients you were assigned tonight, you were meant for you? What if, it's the what if.
Well,
So
I think there's a choice in that. I mean, I have adopted that is how I see the patients that I care for today. That
right, me too.
they are assigned to me. I'm the one that is supposed to be taking care of them today.
Right.
I have, for whatever reason, I have something that they need, and a lot of times it does reveal itself, especially when I'm, acutely conscious of that fact, of that choice
Mhm.
that I've made. When I came back to nursing, I had to write because I had so many issues with the healthcare system. I didn't want to be part of the healthcare system.
Right.
I have so many judgments that I've placed on our healthcare system that it was difficult for me to come back. And so when I was processing the decision and making the choice to return, it was very much a conscious one. And I had to, part of the mission statement that I wrote for myself in returning was that, I can't. I don't remember exactly what it was.
Mhm.
I may work for this healthcare system, but I may be employed by the healthcare system, but I work for this patient. I'm here for this
Yeah.
patient.
Yeah.
It's been a long time since I've reviewed it. It's been, I've been back at bedside for a number of years. So,
Yeah.
but the core of it is that the patient that I'm assigned is the one I'm supposed to be taking care of, and
Yeah.
there is a reason for that.
Yeah.
So there's like a counterbalance that plays
Yeah.
in the mindset of approaching your patients.
Yeah. Yeah. So, it's a decision that you can make even while continuing to work where you're working. I remember I used to, like, almost every shift I just wanted to call in. Like, I would get like work
I
flu.
still feel that.
Well, nobody wants to work, but it's much easier nowadays for me to go to work because I know that I was scheduled on this day. I just work PRN, but I was scheduled on this day. This is what I tell myself. I was scheduled on this day for a reason. Those patients that are coming in today, I am needed there for some reason. And or maybe because I'm needed there so that another nurse could be off, or I'm needed there. I just have a different thought process about it than I used to. And it made my life, drastically better.
Sure.
I don't get work flu anymore. I just think about it differently. It's literally not different. I just think about it differently. And, it
We
is.
should have I'm just thinking we should have something where every, so many thousands of hours that the hospital has to pay for us to take a week off. They just have to.
Yeah.
It should be because that work flu thing, you just get so run down.
Yeah.
Constantly
I was reading something. I think it might've been something that you sent me. And it may be many years, but basically mental health. It's all around mental health and nurses and working in healthcare systems. And that not only should you have, sick hours, but you should have 4 hours each month that you can use for mental health specifically. So you don't have to lie. You don't have to say, you're just there. And because of how mentally draining the nursing profession is, it just should be. And it's being talked about more, but it just needs a lot more. It just needs a lot more talking and advocating, and that's why we're talking. That's one of the main reasons why we're talking, doing our little part,
this is just, it's fun to talk to you.
Yeah, totally. Yeah. Well, and like I've said before, it's very therapeutic. So if you're not on a podcast, you don't have a podcast, start a podcast, or at least, journal or get together with your nursing friends and talk. It's the talking it out. It's really connecting with other people with similar minds is so important, especially on the same level of thinking. It makes a huge difference and such a positive influence for sure.
Yeah. All right. Well, I think that's
rounded it up.
That's about it. Yeah. It's good.
All right. Well, I guess we'll see you all next week.
See you on the other side.
See you on the other side.
We hope you've enjoyed this week's episode.
Remember, the conversation doesn't end here.
Keep the dialogue going by connecting with us on social media posted in the links below, or by visiting our website.
Together, let's continue to redefine nursing and shape a brighter future for those we care for. Until next time, take care, stay curious, and keep nurturing those connections.
And don't forget to be kind to yourself.